Hello and welcome. My name is Barkha Dutt. You're with the Mojo Story, our digital platform that has for the last 15 months focused on only one story, and that is the COVID catastrophe in India. Every day, things seem to be getting more and more bleak, and the question before us now is this: will we ever really fully count and accurately count those of our citizens who are dying from COVID? Almost everybody believes that the official data does not even begin to tell the full story. These are the images that are coming out of crematoriums and burial grounds that we are reporting from every single day ourselves. Let's bring up some of these images as we see cremation grounds that are completely overrun. We are seeing cremation grounds where there is absolutely no space. Spaces are, the grounds are running short of space. Wherever we go, we see undertakers who are telling us that there is absolutely no space to cremate the dead. And what would explain this? What would explain this? These are the pictures, the latest set of pictures that we have from cremation grounds and burial grounds that we've been reporting from ourselves. And like I said, these overrun cremation grounds and burial grounds probably tell a story that we do not want to pay enough attention to, but we need to be paying very close attention to. Like I said, the question before us is not just how many have already died, but how many more lives may be lost, and whether there will be some way to accurately count these figures. In fact, the latest set of images that have come are extremely disturbing. We are issuing a trigger warning for these pictures. These are pictures of bodies that are floating down the rivers in both UP and Bihar. From Buxar, we've had reports. We've blurred out most of these images, but they may yet disturb you, of at least 40 bodies floating down that river. Can we play those pictures, please? Those are the pictures that are playing with a trigger warning there, extremely disturbing pictures that we are seeing of bodies now finding themselves into the rivers in the states of UP and Bihar. And we have seen similar pictures. And like I said, we've had to blur out most of these images. They were far too disturbing to show you in an unvarnished way. Yet it is important to bring these pictures home because they do tell us the scale of mortality that we are dealing with. And if we come out of these pictures, we will show you that there are similar pictures. There are similar pictures that are now coming in from other parts of India. This from Hamirpur, where we also saw bodies floating down the river. So like I said, whether it's cremation grounds, whether it is rivers in the heartland of India, we are now seeing a clear overrunning of space when it comes to cremating the dead and the body count. And this is only one of the questions before us today. And to talk about what might the numbers actually be like, we're joined today from Brown University by Dr. Ashish Jha, one of the world's foremost public health experts. He's been talking bluntly about this. He's been talking about this despite facing resistance, emotional resistance from sections of the Indian population, from sections of the political establishment. But it's extremely important, Ashish, to have this conversation, and we thank you for starting it. Your sense is that the death count cannot be in the late 3,000s to the 4,000s. And I can confirm to you, reporting from the ground, from cremation grounds, and now those bodies floating down those rivers, that's simply not the case. But you want to take us very empirically through the math that draws you to this conclusion.
Yeah, absolutely. And again, this is a very upsetting set of things to be thinking about. But the bottom line is that we have to count the dead. We have to understand the calamity that India is facing, not to cast blame, but first, out of respect for people who have died, and second, to understand how we move forward and how we prevent more suffering and deaths. So in a typical non-pandemic year, let's say 2019, on an average day, between 25 and 30,000 Indians died across the country. And the system we have, the crematoriums, the burials for Muslims, others, handle that just fine. That's what the system was designed to handle. If 3,000 or 4,000 additional people die in a given day, that's not going to overwhelm the system. That's an extra 10 or 15%. These crematoriums would handle that just fine. But we know from reporting, and it's not just in Delhi and Mumbai, and it's everywhere, across India, from across UP and Bihar and West Bengal down south to Karnataka and elsewhere. We see stories of burial grounds, of crematoriums just running over. And
Yeah.
so the question is, what is the kind of number that would cause such a calamity? And when you hear reporting, most of these places are saying, some of them are saying they're seeing 10 times as many cases. Others are saying they're seeing 5 times. So I said, imagine that it's something conservative, like twice as much. That would mean that we have about between 55 and 60,000 people dying every day. If half of those are from natural causes of things that would have happened, that's an additional 25, 30,000 deaths every day. My take is it could easily be higher than that. Could be a little lower than that, but it can't be much lower than that. Not if you are seeing the kinds of pictures we are seeing emerge from the crematorium. So
So,
I think it's very clear that the number is much higher than 3 to 4,000.
so it is your sense, given the baseline of what would typically be non-COVID fatalities in a pre-pandemic time, that we are looking at somewhere between 25 to 30,000, that's a conservative figure, of Indians dying from COVID every day that are not getting factored into that official data that's hovering around 4,000.
Yeah, and look, anytime you make an estimate like this, one of the things I try to do is I try to say, well, is there corroborating evidence? Can I look at some other data as well that makes me think this is likely to be right? And there is. So if you look at the 400,000 infections a day, 4 lakh cases a day that we are identifying, that's with a test positivity of 22%. What that means, if you've been following this epidemic, what you know is that means that India is probably missing 80 to 90% of all infections. Because only when you miss that many infections do you end up having test positivities above 20%.
Hang on,
They're
you said we are missing 80% of all infections?
80 to 90% of all infections. So my best guess is in an average day in India right now, 30 to 40 lakh people are getting infected, 3 to 4 million. That's the true number of infections every day. And then if you do the fatality rate,
Say that for us again slowly, because I don't want to get it wrong. It's a big figure. You're saying we're missing 80% of infections. You're saying your sense is that the active cases are, say it again slowly.
yeah, here's why. Look, when your testing numbers are as low as India's are, and India's testing levels are very low compared to the size of the population and compared to the size of the infections. And what's my evidence for that? It's test positivity. WHO, most of these organizations suggest your test positive rate should certainly be under 5%, ideally 2 to 3%. In the US right now, we're at about 4% test positivity. India's test positivity is 22%. There is no major country in the world right now that is having that kind of test positivity. Actually, there is one. Brazil is also having those kinds of test positivities. It means India is dramatically under testing. And by the way, we can see this on the ground. I have family in Bihar that I talk to who
Yeah.
clearly have been infected with COVID. They have all the symptoms. I asked them whether they've gotten a COVID test, and they have not, because it's hard to get a COVID test. They also know that if they get a COVID test and it's positive, there will be so much stigma, and so they choose not to as well. So most people who are getting infected with COVID right now in India are not getting a positive test.
So missing 80% infections translates into an active caseload in real terms of.
Well, I mean, what I would say is any given moment, if you have 3 to 4 infections, 3 to 4 million or 30 to 40 lakh infections a day, and active infections, people have it for about 8 to 10 days. You can do the math. It's 30 to 40 million or 3 to 4 crores, right? That's what you're talking about in terms of number of people who are actively infected right now in India at any given moment. Of course, most of those people will recover. My best estimate of infection fatality rate, that means proportion of people who are infected who are dying, is about 1%. Well, if you then do the math,
Yeah.
right? 30 to 40 lakhs, 1% of those people are dying. That's about 30 to 40,000 deaths a day. So no matter how you triangulate, could it be as low as 20,000, maybe 25,000, maybe. It's not 5,000. It's not 10,000, because you wouldn't see the kind of effect on the nation if the numbers were that low.
Yeah, I agree with that. And just anecdotally, what we're going to do, these are, by the way, the obituary papers in the Gujarati press, and they tell their own story. There are lots of ways of measuring what's actually happening. The rivers overrun with bodies, the cremation grounds, the obituaries. But I will play out for you, Dr. Jha, just a short interview I did with an undertaker at a cremation site in Delhi, and how he compared the bodies he got in the first wave in 2020 with the second wave. Let's just play this from
और
one
ऐसे
cremation.
वक्त पर जब मैस क्रिमेशंस हो रही हैं एट क्रिमेशन ग्राउंड्स एंड ग्रेवयार्ड्स, हमें उन वॉलंटियर्स की भी दाद देनी है जो ये सब काम सेल्फलेसली एज अ पब्लिक सर्विस कर रही है. यहाँ शंटी जी हमारे साथ हैं. मुझे 2020 में भी याद है शंटी जी और उनके बेटे दोनों ही कोविड पॉजिटिव हो गए, फिर भी उन्होंने कभी अपनी पब्लिक सर्विस यहाँ रोकी नहीं. शंटी जी, सबसे पहले तो बहुत बहुत थैंक यू आपको जो आप लोग काम करते हैं. आप मुझे बताइए, यहाँ जो हम देख रहे हैं वो दृश्य हमें पिछले साल देखने को नहीं मिले. दीज आर मैस क्रिमेशंस. आप ऑन एवरेज एक दिन में कितनी क्रिमेशंस कर रहे हैं?
बरखा, ये वो शमशान घाट है जहाँ 10 से ज़्यादा बॉडीज़ नहीं आती थी. और जब पिछली बार पीक पे भी कोरोना गया तो 20 से 25 तक गई थी मैक्सिमम. मेरे को दिन भी याद है, वो 24 नवंबर का दिन था, तो हमने कहा बहुत डेड बॉडी आ गई है. और इस बार तो रिकॉर्ड टूट गए. यहाँ तो 60, 70, 80 और यस्टरडे 122 संस्कार हमने कराए हैं. अब इसमें अब हैरानी की बात होती है जब अखबार में पढ़ते हैं सुबह कि पूरी दिल्ली में सिर्फ 350 हुए, तो वहाँ माथा ठनक जा रहा है.
So that's a short excerpt in Hindi. He's basically saying, Ashish, that he did, from 25 to 30 bodies in the last year. It's 122 some nights, definitely double or triple on most nights, which kind of proves your point.
Yeah. There is an old saying in global health, because so many countries, especially in a health crisis, fail to measure what is important. There's an old saying that you can ignore the infections, you can fail to test, you can act like something doesn't exist, but you can't ignore the bodies. You can't ignore deaths, because deaths, there is a physical piece of evidence, and there are all the families who grieve around that body. So you cannot ignore it, and that is what is happening in India right now. You have many states where you have political leaders acting like there's not much going on, or we need to ignore this. They can say what they want, but the Indian people are telling a different story, and the Indian people are telling the story of immense suffering and death across the nation, and that can't be ignored.
The problem is that if we ignore it, if we kind of react with the resistance that some of us have to the data that you're putting out very logically, to the pictures that reporters like us are getting from cremation grounds, I am afraid, are not going to step in even now in this month of May, where we are woefully short of vaccines. In fact, the news is really bad, Ashish. We have hit below 7 lakhs in the last 24 hours. It's our lowest level ever. Our daily average is 16 lakh vaccines. We have no way out of this immediate month. And if we are then going to look away from the deaths and the actual data, actually we're saying that, hundreds of thousands of Indians could just die.
Yeah, and the other, exactly right. And the way to think about this is people who died yesterday are people who were infected 2, maybe 3 weeks ago. And if you think about all of the infections that have happened in the last 2, 3 weeks, there are many of those people who will still go on to get sick and who will go on to die. We are going to be in this calamity for a long time to come. If everything goes perfectly from here on out, all infections are stopped, it will still be weeks and weeks of just death after death after death. We're going to be in a very difficult period for a while. But of course, we know that infections are not going to get cut off today, that it will take a while to slow these infections down. So I think the problem with this horribly high number, and of course, all of us are hoping that we're overestimating. All of us hope that the number of deaths is lower than this. The problem isn't just how horrible that one day's numbers are. It's how much longer we are going to sustain this level of suffering. Many weeks ahead of us. We're nowhere near out of the woods on this one.
What should we do? I think the question before us is, what should we do in the absence of vaccines? And, we still do not have a fully stabilized oxygen supply. We're still short of ICU beds. What should we do? The Lancet, has been very critical of the government's handling. It is also quoting modelers to say that we could be looking at a million deaths by August. Even conservative modelers at the Indian Institute of Science in Bangalore are saying at current trends we'd be looking at 400,000, and I think that's severely undercounting given the math that you've just done. So, what would you say? Is there anything we can do?
Yeah, I think we're definitely looking at least a million, but probably many more deaths than that in the months ahead. We know how to stop this virus, right? This is not a mystery. There needs to be a two-pronged attack. Of course, we got to keep working on vaccines. Vaccines are not going to help us, not going to help India in the month of May. They're not going to help us until we get into June or July. And that means, remember, anybody who gets vaccinated today takes several weeks for that immunity to start building up. So it's not like vaccines are the only short-term ticket out. So short-term, it's about stopping the infections. And a second issue, of course, is taking care of the sick. And it is about expanding number of hospital beds. It is about expanding oxygen supply. It is about making sure there are enough medicines. That's one. The other part that I feel like still gets too little attention is how much more testing India needs. I mean, we need to understand where the virus is spreading. And the bottom line is that doing 15, 20 lakh tests a day is not anywhere near enough, not for the size of infection that we have, and not for the size of the country we have. So we need to be doing many, many times that. And there is plenty of testing capacity around the world. Lots of people who are willing to step up. And I think there's more testing capacity within India. That needs to be a major priority, because not only will that help us document what's happening, it actually slows down spread. If you can test enough people, they will find out that they're infected. They will not spread it to others. If most people who are infected don't know it, then they will continue to spread the virus to others, and this pandemic will continue at these horrible levels.
But there is a sense that the official data is so off the mark, both on deaths and infections, that actually no modeling, no policy projection is possible. What would be your health warning to the government in terms of not resisting this data that is coming from public health experts like yourself?
Yeah, what I have said to governments, and I've said this in the US, I've said this in Brazil, and I've said this elsewhere, is that at the end of the day, you can ignore the data if you want, but there is no way to get a handle on the pandemic unless you really have a deep understanding of what is going on. And that therefore you need the data. So this is really about, do you want to manage this pandemic, or do you want the pandemic to drive the agenda? And the truth is that governments, many governments, Barkha, have tried to act like the pandemic isn't there, tried to ignore it, act like we're just going to keep going. It doesn't work. Politically, it doesn't work. Of course, from a humanitarian humanitarian perspective, it's a disaster. But even politically, it doesn't work, because you can't bluff the virus. The virus doesn't care. The virus does what it does, and there's only one way to manage this, which is to bring the infections under control. And the only way we know how to do that is using evidence, science, and data.
What is the mortality scale that you have among the models you've seen, you find yourself most in agreement with? There is, as I said, the IIS, which talks about 400,000 deaths by the 11th of June. And then there is the 1 million cumulative deaths by August, which Lancet is quoting. By your own number of 30,000 deaths per day, maybe more. What is the number you're looking at?
Yeah, I mean, if you just take the conservative estimate of, let's say it is 25,000 deaths a day, that's 750,000 deaths a month.
Yeah.
You can begin to do the math that, here we are in early May. By the end of June, it's going to be certainly well over a million to 1.5 million by the end of June. That's additional deaths between now and the end of June. And what happens?
You're saying we're looking at 1 million more deaths by June, not cumulative.
Yeah, 1 more million deaths by mid to late June. And look, of course, I would love to be wrong, but that's based on where we are with infections right now. If infections get brought down substantially, then those numbers will come down. But that is up to us. That is up to the Indian policymakers, the state policymakers, the central government, and of course, ultimately up to the Indian people.
So till now, we were saying 1 million cumulative deaths. I don't want us to be the harbinger of bad news, but it's important to talk about what we're saying. We're not talking about cumulative deaths anymore. We're saying back of the envelope calculation of 30,000 deaths per day, which is your figure. You're looking in a month or so from now at 1 million more deaths. Not cumulative, but 1 million more deaths.
Yeah, I mean, right now, there's no doubt about it that the number of deaths that India has identified is a very, very low number compared to the true number of cases and the true number of deaths. And what I'm saying is, if you take, let's say you take the 25,000 number that I'm talking about, that's 750,000 deaths in a month. And it's over 1 million deaths by the time we get into middle, certainly by late June, but over the next month. And of course, if it's higher than 25,000, then we get to 1 million deaths faster. If it's a little lower, then we get to 1 million deaths by the end of June. It's all awful. It's all so much worse than what people out there have been projecting.
And if we do not look this number in the eye, because there will be people who will accuse us of being fear mongering, alarmist, causing panic. My worry is that we will not show the urgency that we need to be showing at this point.
Yeah, my entire approach in this pandemic has been not to worry about the naysayers. There are people who always want to downplay everything. There are also alarmists who overstate things. And my approach is, let's look at the hard data. Let's be honest with each other. Let's understand and make our best guesses and best estimates, and then confront that reality. And the reality is that the best numbers out there that I have seen, and I've also looked at other modelers and their data, and the truth is that probably about 25,000 Indians are dying every single day. As I said, it could be more, maybe a touch less, but probably not. And so in that number is our reality of where we are. And you can deny it, you can say that's fear mongering, you can say it's overstated, but those are all families who are going to suffer for months and years ahead. It is absolutely our moral obligation to do everything we can to prevent as many of those. Some of them are going to happen at this point no matter what, because there's so many infections out there. But that 1 million additional deaths between now and, let's say, end of June, not all of that is fated. We can prevent many of them if we do smart things. We can bring that number way down. That's up to us. That's why it's important to look at that number straight in the eye, because it actually motivates action.
So let's spend the last 2-3 minutes that we have with you looking at what that action could be. How do we bring down this horrible number on our screen, 1 million more deaths by June, 25 to 30,000 Indians dying every day? What do we do to bring this number down? Is it a national lockdown? Is it something else? Is it an urgent, somehow magical influx of vaccines? What is it?
Yeah, I don't think, unfortunately, that all the vaccines in the world right now will prevent a majority of those deaths, because right now, those deaths are short-term. Those are about infections that happen today, that happen in the next couple of weeks. Vaccines won't get us out of that. Vaccines will prevent deaths into July, August, and September. Vaccines are very important. Let me not downplay them. Very, very important. In the short run, it's all about preventing infections and about taking care of sick people. So we know what to do, because again, those deaths, many of those deaths, most of those deaths are preventable, and they're happening because the health system is not performing. So we've got to improve the quality and the access to health systems. We all know it. It's beds, oxygen, therapies. That needs to absolutely happen. And then in terms of how we prevent more infections, again, we know how the infection spreads. It spreads when people gather indoors and are not wearing high quality masks. So no indoor gatherings of any kind, keeping people in their household only, making sure everybody's wearing a mask, no large outdoor gatherings. Whether you call what I just described a lockdown, because a lot of states have lockdowns, but then if you look at what they're doing, they're all doing something a little bit differently. But fundamentally, what is necessary is people have to stop interacting with each other outside of their households. That's the key part, because virus spreads when one infected person interacts with an uninfected person. We have got to stop those interactions. And whatever set of policies. And of course, last but not least, is more testing is a really important part of that. If we can do those things, that 1 million deaths by the end of June, absolutely a large chunk of them can be prevented.
Can you be specific? One is do not step out of the house, whether you call it a lockdown or not. Do not interact with other homes. Do not interact indoors. Obviously, do not have mass gatherings. You have already in multiple interviews spoken about the Kumbh Mela as one of the big, huge super spreader events. Those mistakes have been made. I think it's important to offer some hope that those million additional deaths could be ratcheted down. Just give us your last prescription in the last 5 minutes that we have. One, two, three. What should the government of India be doing?
Yeah. So one is we've talked about the lockdown. The second is dramatic scaling up of testing. India has capacity. Lots of countries in the world have capacity and are happy to send those. So that's another area, absolutely. Making sure that we get masks out to the crowd, to the broader population. Mask wearing is a central part of this. You know, we're seeing pictures of large gatherings of people outdoors. That just needs to stop. We can't do that right now, not in the middle of this horrible pandemic. And then we do really have to have a strategy for taking care of the sick. There are too many sick people who can't get access to basic care. I'm hearing this across Bihar, among family and friends, certainly happening also across much of the country. We have got to take caring for sick people much more seriously than we're doing right now.
Finally, we have still not indemnified the mRNA vaccines. Pfizer is still, waiting for this. Sri Lanka has done it. Our vaccine program is in shambles. Just any last thoughts on that? I know it's not an immediate prescription for the month of May. I know we've got to get through the month of May with isolation, lockdown, and better health management, but we do need to start talking about the vaccines too.
Yeah, absolutely. I mean, if you think about the size of the challenge, for India to really turn the corner on this pandemic, India needs to vaccinate an additional 500 million people, at least. That's what's going to change the trajectory of this pandemic in India and prevent future. So that's not going to happen just with Covishield or just with Covishield and Covaxin, as important as they are, and we should be ramping up production on both of those. India needs all the vaccines it can get. The Pfizer vaccine is terrific. It's been authorized and widely used here in the United States. It's about to get full approval in the United States because we have so much safety data. It's been approved in so many other countries. I don't understand why India would not approve it. That should be a priority, but India should be working with manufacturers around the globe to get more and more vaccines in and getting more people vaccinated. And by the way, every country that has done a good job on this has done it with the central government driving this, not individual state governments, not individual private actors. This is a central government responsibility. This is a national emergency. This is like fighting a war. If India was at war, we would not say to states, you put together your own army and fund your own army and go fight. We would have a single national coordinated effort in a war. This is a war. It needs a national coordinated effort.
Well, thank you for that truth telling. I think it's staggering to think about the fact that we could be losing about 700,000 deaths, maybe more, if there is not urgent intervention, whether we call that a national lockdown, whether we call that stable oxygen supply, whether we call that a centralized war room, whether we have the military to build field operations. I don't know what, but we needed that truth telling. Dr. Ashish Jha, always learn so much for you. Pleasure having you on, and we'll keep bringing you back in what is going to be a critical month and a month of great suffering, unfortunately, for our people here. Thank you, Ashish, and we'll be in touch.
Thank you for having me on.
Thank you. Bye-bye.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.